Shifting focus to Omicron. Now, the total number of COVID-19 cases registered worldwide has passed 300 million. This comes as Omicron variant is spreading rapidly. The Omicron variant is like deja vu. Masks at all times, staying indoors, and some version of government restriction. The new wave of pandemic had its first effect on the health system. United Kingdom's National Health Service is feeling the mounting pressure. In London, military personnel have been deployed to support hospitals. In the winter season, hospital usually witnesses a rise in hospitalizations. So the Omicron cases has put hospitals on a war footing. Over 120,000 NHS staffers are off work with COVID.
I'm a GP. I've never known it this bad. We are having to literally contact patients without notice, saying that the staff member, a doctor or nurse, just isn't in today because they're self-isolating. This is not normal. And therefore, the government does need to recognise this is clearly an NHS under extreme pressure, and the living reality, sadly, for thousands of patients is they're experiencing the suffering, the consequences of such pressures and also staff absence.
Meanwhile, on the first day of term after Christmas in England, more than a third of schools had over 10% of their staff absent. Why? Because they are down with the COVID-19 infection. Moving on to Germany, where maritime state of Bremen has the country's highest vaccination rate. But in the latest wave, it has become the hardest hit because of Omicron. The 7-day infection rate in the region stood at 800 cases per 100,000 residents. This is more than double the national rate, which is 303. Coming to Australia, the country's the most populous state could peak by the end of January. This is what is being predicted by officials. Authorities have reinstated some restrictions to curb the fresh spike. Daily cases in NSW shot up to over 38,000, exceeding the previous pandemic high of 35,000.
This is a challenging time, not just in New South Wales but around the world, but the efforts that our people have made has kept New South Wales safe, has kept New South Wales open and kept New South Wales strong.
Moving on to Xi'an, a city of 13 million in northwest China entered its 16th day of lockdown. Residents have complained about curtailed access to food and medical care. Now, the story of a pregnant woman who lost her unborn baby after waiting outside a local hospital for 2 hours provoked anger. The government claims that city officials have been punished. The Health Commission has also apologized now. Moving on to Japan, which has now approved restrictions to control the Omicron outbreak. The new measures include earlier closing hours for restaurants, a ban on serving alcohol, and restrictions on large-scale events. The restrictions are going to last through the end of the month. Meanwhile, Brazilians with COVID-19 symptoms are facing long lines to get tested. This due to lack of kits. Brazil has failed to implement any testing strategy from the very start of the pandemic in 2020. Now, to make matters worse, some of the health ministry's databases have been offline since a hacker attack on December 10th, despite having the world's third deadliest outbreak. The government has still not been able to fix the error even after 28 days. Staying on with the story. Now, the emergence of the fast-spreading Omicron variant has triggered fears of reinfection. According to some latest studies, the risk of reinfection with the Omicron variant is 5.4 times greater than that of the Delta variant. Now, for those who have caught the variant, a string of hugely positive studies show that Omicron is less severe than other strains. Despite being less severe, its high transmissibility rate has put the countries off the guard. Now, questions about a person's general immunity has also come in the forefront. While many people have reported a reinfection even after being fully jabbed, many have remained safe from the virus. Now, since the first outbreak. So the question is, why is this the case? And how some people are successful in evading the virus? Well, according to top health experts, some lucky people have a natural built immunity that gives them an extra edge over others. Experts in Britain and Brazil have launched studies to know if some humans already had an inbuilt system that was prepared to fight the virus. And for those that keep catching COVID, it doesn't necessarily mean the immune system isn't working. According to experts, this can be because they are more prone to viruses or the immunity has waned in the course of the pandemic. Now, an ongoing research at Oxford University and London's Imperial College are testing how easily some people catch COVID compared to others. Volunteers are being exposed to the same virus and then kept in isolation for 2 weeks. Now, to analyze the immune responses.